And the World Health Organization is worried that Africa could face a silent epidemic if its leaders fail to prioritize testing for the virus. The Director General, Tedros Adhanom Ghebreyesus, said Africa was the region with the fewest diagnosed coronavirus cases, accounting for less than 1.5% of the global total and just 0.1% of deaths. Dr. Tedros credited the continent's experience dealing with other epidemics as helping it scale up its response to the coronavirus and being spared the impact seen elsewhere so far. And joining me to discuss this is a medical doctor, Femi Oyekan. Good to have you join us, Dr. Femi. Now, when you look at the fact that, according to a report by the World Health Organization, Africa has just tested a little over 1.5 million people, and then cities like Wuhan in China tested 6.5 million people in just 5 days. Are there reasons to be worried?
I'll say absolutely there are reasons to be worried about, but you also need to know the peculiarity of the situation in Africa, that prior to this, Africa has not have a good health seeking behavior. If an African person is ill, you possibly would have tried traditional means, would have tried religious means, and usually the last resort is seeking professional health advice, which in a lot of ways has not been in African favor. So that's why you will see this kind of huge disparity, that Africa as a continent has not been able to test as much as Wuhan as a city. So these are some of the factors you will consider. And also another factors you also consider in Africa state is stigmatization. When you have people feeling like once you're diagnosed with the virus, you are supposed to be ostracized. This has also played an important role in making people willingly want to volunteer themselves to seek professional guide. A lot of other factors to be considered. Another one is education. Our people are not as much compared to other Western world or maybe UK, United Nations, United States. We're not as educated as all of these nations where testing has just been a profound and a progressive, I'll say progressive idea. Yeah.
So if these challenges abound, for example, you are saying that it's been difficult to get the right samples into the laboratory, and that's because of how the awareness of people as regards COVID-19 and stigmatization in general. So should African countries have eased the lockdown knowing that these challenges are there?
I'll say that one thing you can't take away from Africa as regards to this pandemic is leadership. Africa has demonstrated credible, strong leadership in terms of the lockdown, not allowing international flights from diseased nation to come to African shores. So this has also played a significant role. And when you look at the fact that the way Africa managed the lockdown, where you have military on the streets, where you have police on the street, it's not the same way when you go when you go to countries like UK, Spain, America. They just tell people stay in your home, and people know that the health benefit of staying at home is very credible. But in Nigeria or South Africa, if you have to use police to enforce chasing people at home, and in a way, even though this doesn't look modern, but it has helped Africa a lot.
All right, so let's look at the issue of testing kits, which is a big challenge for almost every country. Now, there's some African governments or African leaders who have placed orders in early March and are yet to receive these orders even 6 weeks to 8 weeks after. Is there a way to bridge this gap?
Well, I'll say that the way to bridge this gap, I'll say it possibly would have been for our own scientists, our own industries. We have Pfizer, we have other pharmaceutical companies that are producing these test kits in America, in Asia, in Europe. They also have local centers in Africa. So it would have been in a way to stimulate these local centers that have capability of producing test kits so that they can have they can produce it in mass and distribute it to. But I think one other thing you need to bring to this table is how available are the testing centers? How close are the testing centers to the people? Like in Lagos, you see very few testing centers. Lagos is a population of over 20 million. How can 20 million people access like 4, 5, or 3 testing centers? That's absolutely unthinkable. So you need to bring down these testing centers to a lot more smaller communities to make sure that people don't have to pay transport that is not even available to get to the testing center. If this is done, you will see that even though the stigmatization is there, poor health-seeking behavior, the testing capacity in Africa will significantly go up.
So, Dr. Femi, on one hand, you have said that Africa has issues with getting the right samples to the laboratory, the issues of proximity of these laboratories to residents. And on the other hand, you're also saying that African leaders have demonstrated good leadership in this time. So, are we under-recorded, or we have been able to contain this virus?
I'll say both. On this instance, I'll say both. Even though the numbers are artificially low, but the method we have used so far has been effective in keeping it low. Let's do comparison. You can with fairness, you can compare countries like Brazil and Nigeria and South Africa without holding anything back. In the case of Nigeria, what happened? There was a strong sensitization. Minister of Health, Senator Mamora, Chris Ngige, Dr. Chris Ngige, the Center for Nigeria Disease Control, there was daily sensitization. And then, in a way, this goes a long way. Information dissemination and all of that goes a long way to getting people to act in the right way. When you compare to Brazil president came out at the outset of April and said, no, this is just another flu. People can go to party, the beach should be kept open. And as of today, I'm telling you, as of today, Brazil has recorded the highest single day number of coronavirus positive case, more than any other country in the world. So as much as I know that our figures are significantly not looking like it represents what's happening on the ground, but I will also say that in terms of leadership, in terms of when it comes to dealing with coronavirus, give it to Africa. They've demonstrated strong capabilities and they've shown grace in terms of how they've represented our people.
All right, so Nigeria's Ministry of Health is now screening 19 local firms for the production of herbal drugs that can possibly treat or cure the coronavirus. What's your thought on this?
Well, any local solution that can be effective enough to alleviate our problem, I think she should be welcome. But what I'm saying is, like the last time when one of your colleagues asked me a question that, what was the capability of Africa producing a medication or a vaccine that can be like the golden bullet in terms of this crisis? What I said is, Africa has not been on the forefront in terms of innovation and human capacity development and in terms of creativity and solution production. But what we know is the fact that you know this is true, that if Africa is struggling to produce toothpick, now you're now saying they want to produce antiviral medication. That would be very difficult to swallow. But I'll say that if the 19 test trial going on in Nigeria or any other place in Africa that looks like it can bring something to the table, let's give it the financial boost it needs. But I don't know if WHO will be funding it, but I doubt if they want to fund those kind of projects. But I think Nigeria should be able to see which of these other trials can show some level of impact on the ground before they take it to the global stage.
Right, so Dr. Femi, you would also agree that we've seen at least some level of innovation coming from Africa this period. For example, the $1 test kit coming from Senegal. So if African leaders or African countries decide to collaborate, isn't it possible that we'll have something good in terms of vaccine or cure or even any kind of treatment coming from this continent?
Well, I'll say that, let me be clear. Let me be clear in terms of where we stand when it comes to Africa. One of the leading, I think it's Sendavira, that's the name. One of the leading drug on trial in New York is being led by a Nigerian. That's Africa standing up on global stage. Now, if you say that, do we have the same capacity to try something Africa on African soil? I'll say, with what I know, I strongly doubt it. But a lot is changing now. The global, the world is more flatter. Information is jumping from one end of the world within seconds. So, whoever has any credible thing that is bold enough to take it to the center table, I think scientists across the globe are going to be willing to welcome it.
Medical Doctor Femi Oyekan, thanks for sharing your perspective with TVC News.